everybody, happy Friday. Hope everybody had a great week. I wanted to do a video today on what to do when you have an acute injury, or also what not to do. So we used to think that RICE, so rest, ice, compression, elevation, was the way that we would treat an injury. So athletic trainers, physical therapists, any lay person that had an injury would think that, okay, this is the way to go. So in 1978, Dr. Gabe Merkin coined the term RICE. And in a fairly recent article, he came out and said, but now it appears that ice and complete rest may delay injury. So the reason for that is that inflammation is actually the first stage of healing. So it is the most important stage. So we have inflammatory cells called macrophages that will release insulin-like growth factor, so a hormone, to help with the healing process. So if we ice, then we are going to delay that healing process, which is the number one, again, kickstart to our healing. The other thing is that and this is something that I always used to think, because I never ever, even when I first started personal training, which has been at this point 20 years ago, I never believed in ice. I didn't know why, but my thought process was, ice vasoconstricts and we need to increase blood flow for healing, so it never just logically made sense to me. And that is exactly right. So when we ice, we're constricting blood flow. And again, to kickstart the healing process, we need blood flow. So it's super important, again, to not negate that process. The last couple things, I just kind of made some notes, so I wanted to hit all the key points. So ice can also reduce strength, speed, coordination, and endurance. So a lot of times we would think, okay, you're an athlete, you're on the field, you get an ankle sprain, so we're gonna ice it and try to rehab it, but then ultimately maybe send you back out. So the thought is you're trying to decrease swelling, but really that does not have any effect on inflammation. And it can negatively impact all of these performance-based goals. So again, just yet another reason. But with that said, anything that reduces inflammation, so things like any NSAIDs. So again, we would think rest, ice, compression, elevation, and let's take an NSAID right away. So Tylenol, ibuprofen, Advil, something like that. So again, if we think first stage of healing is inflammation. So if you're taking something like that, immediately you can potentially be delaying the healing process. So my recommendation for that is, if you need to take one, if you're really it's that unbearable that you need to take something, wait at least 5 days before you take something. But really, I won't get into this in this conversation, but it can also negatively impact your gut the more that you're popping Advils, Tylenols, Aleve, etc. So just keep that in mind as well. So I would say if you cannot take those, I would try not to. But any other immunosuppressants, so sometimes if people have some type of autoimmune, if they have cancer and they're dealing with, they're taking medications, that can also impact it as well. And I think I already said, and cortisone as well. So that is another one. So there's a lot of things that can, again, affect the movement or the injury process. And the thing that I always recommend, so whenever somebody asks me, what do I do when I get injured? So what do I do if I sprain my ankle, if I hurt my shoulder? And my number one thing I always say, I said it a few times this week, is move. So moving is going to increase blood flow. Moving is going to make sure that your nervous system is safe. So our nervous system, we always want to be safe. And so when we start to protect, so if your neck hurts and you can't turn to the right and then you just keep walking around like this and don't move freely, then your autonomic nervous system goes into a fight or flight or freeze mode, and you therefore do not stabilize well, and you become very protective. So the muscles, and so when people think they're spasming or they're really tight, or that's your body saying, hey, I'm going to protect you. But the problem is that the more you feed into that, the longer something lasts. So my number one thing is always move, 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 move. Do not sit still, do not stand still, just keep moving, keep changing positions, move as normally as you can. And then the second thing is not to ice, right? So we talked about, there's really no real benefit except if you can use it as an analgesic, so for pain inhibition. So if you just feel like I really need ice to decrease some of the pain, you would just do very short duration of ice. So maybe 5 minutes at max. You don't need to necessarily do 10, 15, 20, because then you're going to create some stiffness and things like that. So if you need to, for pain, then you could use it, but just a short duration. The next thing you can do if there is swelling is you definitely can still elevate. That's fine, but just remember that movement is what's going to pump blood flow the most efficient. That's our body's natural system. That's what we're really good at. And if we continue to move, then we should be able to really manage that well. You can use compression. So ideally you want a gradient compression. So if you were using a compression sleeve, whether it was arm, leg, etc., that could be something you can also incorporate into the healing process to try to pump that fluid back if there is swelling. So there are obviously a lot of different ways to address an acute injury, but again, in summary, the number one thing is make sure you continue to move. If it's really, really painful, just move to what you feel like you can do that doesn't create a significant pain response. So move gently, move intentionally, which is something that we would want you to do anyway. I always recommend diaphragmatic breathing as well to help to inhibit pain. So that can help to just relax everything and inhibit your pain receptors as well. So not recommending NSAIDs. So if you have to take one, wait at least 5 days, because again, that can delay the healing process. The ice can delay the healing process. And again, if you need to use compression, that is also another way to, another thing that you can include. And then the last thing I just want to mention is just regarding inflammation in general. Is a lot of times what can happen is we can have a acute episode of inflammation. So think of it as like a local inflammation. But then that could move into a chronic inflammation. And a lot of times for many, many people, we end up with a loss of tolerance. So somebody that had knee pain now has hip pain, now has shoulder pain, and then now they sprain their ankle. Now they get a cold. So what happens is people become less resilient and they continue to just have this chronic inflammation, and it's more systemic, which is it's a whole other process that you really have to navigate. Is why are you or someone you know having this significant loss of tolerance and immune dysregulation. So that's where you really look into diet and nutrition and really figure out, do you have these inflammatory triggers that you're potentially consuming on a daily basis? So certain foods that might be aggravating you? Is it certain toxins? Is it stress? Which is one of the things I talk about every day. So if you're not managing your stress well, then that is something that is absolutely going to increase pain. So your pain sensitivity is higher, but it is also can delay your healing process. So I always say, I kind of know right away when I work with somebody if I'm going to be able to kind of get them in and out, or if it seems like there's a lot of things going on from an overall health standpoint that we need to address some nutrition things. We need to maybe address some mental health things, whether I refer them out or we work on mindfulness and meditation and different things that they can integrate into their lives. But there are a lot of other factors that can affect how well you heal. And one of my clients this week kind of spurred my thinking about this, and he had just a bursitis in his elbow, and it didn't go away quickly. So we did compression, and I did, some joint mobilizations, and I, did a lot of other things. And then I finally I suggested him that he take curcumin and black pepper, and he did it, and within a week, it resolved, which had gone on for way too long. And come to find out, I didn't know this, but that he was drinking alcohol quite frequently. And that is something that can absolutely affect your ability to regulate inflammation. So, we obviously kind of touched on that, but it's just an example of, I didn't necessarily know that. I've seen him as a patient for physical therapy, so we didn't really talk about that. But it was definitely a factor in his healing that definitely deleted. So I just want to give you some perspective on it to help you understand that there's a lot of factors that go into it. But the biggest thing I wanted you to take away with is that the rice treatment is kind of, it's gone with the wind, and including the inventor that coined the term, he totally agrees based on research that is not what we should do, and we really should be moving and not resting. And we don't need to ice. We can just kind of keep everything moving in the right direction and try to optimize the healing process. So I hope that helped. If you have any questions, feel free to message me. You can direct message me or post in here. And I appreciate your time. Thanks for tuning in. Bye.